Hello there, Lebur Rohman, Consultant Sports Knee and Joint Replacement Surgeon. In this video, I'd like to talk to you a little bit about ACL reconstructions and in particular with an emphasis on an additional procedure called a lateral extra-articular tenodesis, which is done in addition to the ACL to help with the function of the knee and reduce the re-rupture risk of an ACL reconstruction. So first of all, let's talk a little bit about what is an ACL rupture and how it's diagnosed, and then we'll talk a little bit about the management. So ACL rupture is where the ACL ligament, which is the ligament in the center of your knee, ruptures often during a pivoting non-contact injury. Often the patient feels a pop, a twisting injury, and immediate swelling. Commonly the patients say that they cannot continue their sport and have significant swelling and pain for a few weeks. Often this is diagnosed with an MRI scan. It's quite difficult to examine an inflamed, swollen knee, and an MRI scan becomes quite essential in diagnosing this injury. Once diagnosed, the surgeon will often ask the patient to carry out non-operative measures such as pain control, swelling control, and improve the range of movement before any definitive treatment methodology is chosen. So what I tend to do is I provide a bespoke solution to the patient. And what I mean by that, many surgeons use one graft type. But however, every knee is different and every patient is different. And even within the same sport and elite athletes, every position is different. So a fullback needs a different type, an ACL reconstruction compared to a central defender or a goalkeeper probably, and again compared to a striker in football. And then again a different graft may be needed for a 100-meter sprinter or a martial artist. And so therefore I provide a bespoke graft, and the graft choices often include patella tendon, quadriceps tendon, or hamstring graft. And we can also use allograft, which is donor tissue from other people that have donated tissue. So there's many intricacies of how we go about reconstructing the ACL. Essentially, it's a day case procedure where we reconstruct the ACL. The patient often goes home the same day. But I particularly wanted to talk about a newer procedure which is being done called the Lateral Extra-Articular Tenodesis. And this involves, at the same time of doing the ACL reconstruction, an additional ligament is created on the side of the knee. So the ITB band, which surrounds the thigh muscle, a strip of this is taken and tunneled under the lateral collateral ligament, or the ligament on the outside of the knee, and placed within the femur, creating a new ligament, which provides excellent rotational stability to the knee. And large-scale multinational studies have demonstrated doing this additional 10-15 minute procedure with the ACL reduces the re-rupture risk of an ACL reconstruction by 40%. with no real downside to doing the procedure apart from an extra 10-15 minutes onto the end of the procedure. So in my practice, in most physically fit and active individuals who require additional stability and in particular rotatory stability, I will perform a LET with the ACL reconstruction to provide better function for the patient and potentially better longevity for that graft. So if you'd like to find out more about having an ACL reconstruction and talk about different grafts and this additional LET procedure, please get in touch. Thank you.